All right, we'll get started here. Good morning, everyone. It is another fantastic Monday morning here at Health Plan Markets. It's 9:02, and I am currently in Atlanta, Georgia for a conference this week. So I've been running the gamut here, but looking forward to getting back home this week. So excited about that. Um, in all goodness, I am very glad that you all are here this morning. We have a few things to go over this morning, and we have a special guest from Salud VIP, which is a doctor clinic that has several locations and growing all over the country. So glad to have them on board this morning, and we're gonna give them the mic in about 15 minutes. But we are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission, and thank you for doing what you do every day for your clients. As we normally start, we're going to jump through the training calendar this morning, and we've got a few things heading your way. So here we go. So today we've got Humana. They're doing a training on knowing your SEPs for all your selling. This can be one of the best trainings for you this time of year because over the weekend I've had several agents call me, text me, hey, I have the situation, what SEP is available? So knowing your SEPs is crucial at this time of year if you want to continue to grow your business and get ready for open enrollment. So yes, you can stack leads, but if you have a special election period, it's all about that game. How do I find that SEP? Okay, so that's a great training. United Healthcare is doing a member retention training at 1 o'clock today. Also at 4 o'clock, Humana is doing a chronic special needs plan. They've got some chronic special needs plans as well. Again, that's SEP training. Moving over to tomorrow, WellCare's talking about their Silver and Fit program at 9 o'clock. Two trainings at 10 o'clock tomorrow, one for grassroots and Humana's program in a box, which is really great if you're out there doing field marketing, which we're going to talk about today. And why UHC? I mean, that should be pretty easy to understand. They're the number one insurer in the country, but hey, if you need to know why, you can learn at 10 o'clock tomorrow. And then Devoted's doing an 11 o'clock training, open training for anyone that may be new to Devoted or needs a refresher. Humana is also doing a training at 4 o'clock tomorrow on how to retain your book of business. This time of year, you should continue to be marketing yourself, but you also have to put an emphasis on building the relationship with your book of business. You don't have any other time of year to do this. During AEP, you're so busy, it's really hard to build relationships because it's go, go, go time. So we're going to talk about retaining your book of business. That's on Tuesday at 4 o'clock. Wednesday, 9:30, our very own Ask Al Clancy is available from 9:30 to 10:30. Please keep in mind that he is there as your virtual coach. He's there to help you if you feel that you've gotten stuck or hit a plateau or you're just getting started. Al is a great resource to kind of guide you on what you need to do next. Also on Wednesday, we've got the contracting team still doing their question and answer sessions. If you have any contracting questions or situations, it's a great time to jump on the team. Both Jessica and Sam will be on that call on 11 on Wednesday. We've also got Cigna virtual office hours. They're available on Wednesdays at 11. Moving over to Thursday, Aetna DSNP training. Again, dual eligibles are out there, and this is a great time of year to make sure that you know what you're talking about. So Aetna's doing that training at 10 o'clock. United is doing another one, same thing, DSNP training at 1. We have launched our very first portal iteration with HQ, and we will be hosting weekly introductions for those of you that are interested in jumping on our brand new portal system. There's a lot to go on with that, and so we're going to be starting our weekly trainings this week at 3 o'clock on Thursday. I believe we're going to do that every Thursday. If that time doesn't work for you, we will have pre-recorded sessions and webinars coming soon. I do know that we're working on that. So, but live training, so you can get your questions answered on our portal system. It's not too hefty. It's pretty intuitive, but it's really also a great time to kind of learn what's in there and why you need to use it. So that's on Thursdays at 3 o'clock. And then if you're in the Tampa market on Thursday, WellMed Optum is doing their agent mixer in Tampa at 5 o'clock. So grab a drink, meet a doc. That's how we do it. And then Friday, last training is HPM Shop, our quote and enroll tool for Medicare and Medicare Advantage plans and supplements. We have our very own Tom Ryan that'll be available from 9:30 to 10:30 on Friday for anyone that has questions or getting started with our quote and enroll tool, HPM Shop. So that's the training for the week. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. That's how we do it. Okay. Sergio had reminded me this morning that there are certain carriers that have production requirements from you as an agent, and you have a minimum of sales that need to be done on certain carriers. So as a reminder, it's April, giving everyone a very big heads up here. There's a few Medicare carriers that require a minimum sale amount of 1 sale per year. And those two carriers are Humana and United Healthcare. So we've seen some situations where agents do not, they contract with Humana, but they don't do at least 1 sale within 12 months. And if that happens, if you don't do a sale, they will terminate your appointment. And if you want to get it back, you have to pay your old appointment fee and your new appointment fee all up front. Okay. So you have 8 months here, give or take, to get a Humana sale on the books. And same thing with United Healthcare. United Healthcare requires that you write at least 1 Medicare Advantage plan per year. So make sure that you're doing that. I want to make sure that that I give you guys heads up on that. Now, shifting to ACA, Ambetter does require you to have a certain amount of sales per year. Otherwise, they will consider terminating your appointment as well. They've been a little, loosey-goosey with it, if you will, but make sure that you have some good production there, maybe 10, 15, 20 applications for Ambetter if you're contracted with them. And then same thing with Molina as well. So these guys are getting very attuned to how much money they're spending on appointment fees. So every time that you contract with a carrier, they have to pay the state to appoint you, and each state that you're appointed in. So it gets very, very expensive for these carriers. And so that's why they're doing what they're doing. So if you're not, 100%, hey, I don't know if I'm going to sell this plan, don't contract. Just wait until you absolutely need that product, because these carriers will terminate you, and then you're going to end up spending money for nothing. So it's just not a good look. Get it when you need it, and then we'll take it from there. But it doesn't take long to do contracting if you're new to the carrier. Usually most contracts on average are, give or take a couple of days to fill out the contract and get appointed. And RTS, about a week is average. Transfers are a little bit harder, a little bit more difficult. So, just keep that in mind. But new contracts are relatively clean and easy to do. So there it is on that. Now, I did want to spend a few minutes talking about the new CMS rules that have been sent out to all of us, not last week, but the week prior. And I had the opportunity to go to Las Vegas for Medicarians, and there was a lot of talk about the CMS rules. Now, before I say anything further, I know I talked about this last week. There's still a lot of misinformation out there. There's still a lot of people, what I call yakking about, what may occur, what may not occur. The bottom line is right now, the official word is, and there's different people saying different things because they have different opinions about it. But I will tell you that the black and white of it is this. There will be no more HRA fees paid by the carriers. There will be no mileage reimbursement or gas cards. There will be no more quote unquote marketing dollars being paid to you, the agent, directly from the carrier, which is happening. And of the sorts. Okay. So But the good news is everyone's getting an additional $100 for their first year commission for Medicare, and a renewal of $50. So that's the CMS guidelines for what they call administration fees. Okay, so that's been standardized now. No more $400 for an HRA, and all of this is going to come to effect October 1st. Okay, so it's business as usual until October 1st for that. There's also rumors that FMOs are all going away. They're not going to pay us our administration fee. Again, that's not what's read there. Everything in context was for the agent and not agencies. Now, they did mention us, and they are keeping an eye on us. That might change in the future, but everything that I mentioned here is agent facing. Okay. The second part is lead generation. The other big part of it is saying, hey, look, if you're buying shared leads or non-exclusive leads, that business is over for Medicare. You cannot purchase those leads anymore. You cannot use those leads. Essentially, what's happening is these leads are being sold to 30, 40 agents, and the senior is getting blown up, and it's not good. So that's where the majority of this decision making comes from, and it makes sense. So if you're purchasing shared leads until you won't be able to do that after 10/1. Okay. So lead generation is going to be one-to-one, meaning that, hey, these are exclusive leads. No one is going to, resell those leads to anybody else. So that's part of the equation there. Okay. All right. So last thing I do want to talk about is ACA business. This is a good time to, consider that, because as Medicare continues to kind of wrap their hands around Medicare Advantage, Medicare supplements, we're seeing, quite a bit of shifts in the industry. We're seeing providers that are very nervous. We're seeing carriers that are very nervous. It's a good time to think about diversifying your portfolio. So if you're not doing ACA business, individual and family plans, this might be a time to dip your toe in the water. We have folks on staff that can do trainings, and we'll get some trainings on the calendar for ACA business, the 101s and some basics training. But there are tons of great carriers out there, and this is a good time of year to really consider individual and family plans as a diversification of your portfolio. You can throw a rock and enroll somebody in IFP business. It's a great business to be in. It's a lot less regulated. Okay. You can do a lot of the things that you can't do with Medicare. You can almost do everything, with Medicare or with ACA versus Medicare. So, consider that as far as your marketing. I'm seeing agents out in the field. Great job this weekend. I saw a few of you out there this weekend, saw some pictures, at the events. And so, yes, you might be at an event for seniors, but then you might have 3 or 4 people walk by that need your help for IFP business. So you don't want to throw that business away. You want to capture that as well. So, being multifaceted is the key and the name of the game if you're really looking to up your ways here. So there it is. All right. So let's see here. It's about 9:16. I'd like to hand the mic over to VIP Care. Do we have VIP on the line? Salud VIP.
Yes,
Jared?
good morning. Can you hear me?
Yeah, we've got you.
Perfect. Thank you. We are new in this platform. We don't use Ring Central, but it's good. We are here.
Yeah, you got it. Well, welcome. Yeah, please tell us about yourself and give us an intro on what we need to know with care.
Yes. Thank you, Justin, Nick, Sergio, to let us, be here this morning. We are Salud VIP Care. We are under Better Health Group. So this is the big umbrella, and we are part of that big umbrella is Salud VIP and VIP Care. So I'm JD Torres. I'm the sales marketing manager for Central Florida, East Coast. So I cover all the Orlando area, Seminole, Volusia, East Coast until Boynton Beach. So I'm working, I have my team here. I would like to introduce part of my team because the idea for this, for be part here for this meeting is, trying to work together, see what we can do for you and for us as well. So doing a really good partnership. And I would like to introduce part of my team. I don't know if I have here Maria Angelica, Miguel, I think I see Carineo, Wendy, Vanessa. So I would like to introduce each of one of my team to, because we represent each territory. So Maria Angelica, can you introduce yourself, please?
Sure. Hi, good morning. My name is Maria Angelica. You can call me Angie as well. In charge of the Orange area. So if anything, please reach out. I will put my cell phone in the chat if you want to reach out to me. Thank you.
Thank you. Maria Angelica, she's working the Orange County. Miguel. Miguel.
Yes, good morning. My name is Miguel Quiñones. I'm here with Salud VIP. I cover in the area of Altamont Spring, Oviedo. If any agent, I know the like you say, the CMS is cutting the budget for marketing. So we are here to support you guys on any event that you guys have. Please, you can contact us or contact my manager, Jerry Torres, and she's going to be able to give us information about all the marketing rep that we have around. Nice to meet you, everyone.
Thank you. I have Carineo.
Hi, good morning. My name is Karenelle. I've been with the company for about 5-6 months now, but I've been doing this for about 2 years. I focus in Deltona, DeLand, and Sanford area.
And I think I have Wendy. Is Wendy here? Or Paige?
Paige said that her mic isn't working. She put her information in the chat for everybody.
Okay, yeah, I have Wendy working the Polk area, and Paige, she's working Orange as well. So remember we have Salud VIP. Maria Angelica, she's working Salud VIP. And Paige, she's working the VIP Care clinic office. I don't know if it's Vanessa here. I don't think so. I don't know. But well, I'm gonna send you, Justin or Nick. I'm gonna send you all the information that maybe you can reach any of my team. But
Yes, please.
what I say,
absolutely. Yeah, if anyone needs, I see people are asking about Palm Beach County, and Osceola. So if you need to connect with VIP Care, they have clinics all over the state. We'll make sure that we connect you with the correct marketing person. So yeah, if it's easier, you can just shoot us an email at support@askhpm.com. But they are putting their contact information in the chat here, so you can grab it, and they'll connect you as far as events are going. So
yeah, thank you. Thank you for letting us be here. And we are here to support you guys. Thank you.
awesome. So can you tell us a little bit about what's new at VIP? I know you were talking about the structure, and you have different brands out there. Can you kind of describe the brands? Because I think folks might be a little confused about, Better Health.
Yes.
And
Better Health
Votion.
is the main company, but
Yeah.
it's just one company. So we have Salud VIP. Salud VIP is more dedicated for the Hispanic population. Doesn't mean we don't see any other languages, but we dedicate it because the office in Salud VIP, everybody is full bilingual. So I'm VIP care, so we see everybody. So, and
Awesome.
one of the things that the stronger we have is we have our panel. We close the panel for 600 patients. So that means the doctor see around between 10 to 12 patients a day. So that's great because we're taking care of this patient, more closely. So other thing, we offer transportation. Our managed care is really, really dedicated for that senior same day appointment visits. So if you want to meet one of the doctors, just let us know, and you're more than welcome to come any other office.
Awesome. So your team is out there in the field, and obviously you're looking for leads for VIP. What kind of events are you doing, and what do you see that would work for the agents that are on here? Maybe they're a little scared to do events. What would you recommend, and what's best practice for you and your team?
Well, each territory is different. I think Maria Angelica, she can tell us what is working in Orange, and Karineo, she can tell us what is working in Volusia. Can you guys let us know, please?
Well, in Orange for me is working going to the communities, doing different activities, not so much like bingos. Well, they love bingo, but the raffles is the best choice because they give you the information, they're very interested. And we were talking with my other coworkers to do things different, like going to Dunkin' Donuts, going to Dollar Tree, put a table, and to get more traffic of patients coming. And actually, one of my offices, which is East Orlando, they let me put a table outside. So I had a food pantry on Saturday. Not a lot of people came. So I have a lot of bags. So what I did was make a huge 2 baskets, and I'm going to raffle them on Friday. So I'm going to create the flyers. I'm going to take them tomorrow around the area. And I know I'm going to get a lot of traffic for that because one of my coworkers did that too for a supermarket, and it was very good. I think that's the difference now that I'm doing. Thank you.
As far as Volusia County, even within Volusia County, Deltona and DeLand are very different. DeLand, there's 50,000 senior communities, so it's not hard to find anywhere to go to. But Deltona, there's one, and that one's not very open to talking with the residents. So what I feel like works for me best, I've connected with a lot of different like pet supermarkets and just different places where I can try and reach out to that community. I did a pet day in our office, and I'm doing another one next month that went pretty well, where I brought out a mobile groomer to clip the dog's nails and just try and connect with them. And then they also had some ideas of doing like a puppy, like I think they said like a pool party or something like that. So just trying to do different things to try and connect with that group as best as I can in the area.
That's brilliant. We were at the Medicarians. They had this area. It was like a puppy park, and they brought in puppies. It was just unfair. Everybody was over there. That is brilliant, by the way, going through the dogs or the animals to get to the person. I love that. That's a great idea. Most seniors have pets. Some of them live alone, so they want to have some type of companionship. So tapping into that hobby or that lifestyle, it can get you through the door. So that's brilliant. Thanks for sharing that.
Yes, we're trying to find different way, because sometimes when you visit just the community, there is like boring for them. Sometimes they don't want to go to the activity. So we're trying to find another way to get in those senior.
Yeah, I see in the chat, karaoke, bingo, and lots of food.
Yes.
Yes. I remember back in the day, we used to do ice cream socials, and that worked pretty well too.
Yeah.
Ice
For
cream
summer,
social.
it's great social ice cream.
Oh yeah, yeah. And you can show up. I think there's companies now that have like a little ice cream cart. They'll show up with the ice cream cart
Mhm.
and everything, so you don't even have to do anything, which is pretty awesome. So
Yes.
very good. Rosie, you have your hand up.
Yes, I have, because I want to give a big shout out to Cecilia Frankenwich here in Zephyr Hills. We are actually working together, and we have a monthly Medicare 101 in Espanol at the Golden Corral, where everybody here in Zephyr Hills, all the seniors come. So it is something that we're starting, and it takes sometimes tenacity and yeke, right? I share that, but she has been very involved in the community. So Dr. Santiago is amazing. He's the one
Mhm.
here in Zephyr Hills, and they just had an open house for the Dade City location too. So just as a seasoned, because I don't want to say that old, as a seasoned agent in the field for over 20 years, the
Mhm.
one thing I can share to the new agents is tenacity, doing the same thing over and over. Even if sometimes you don't see the result immediately, once you have that partner that understands that, it is going to work. And it has to be something that makes you unique, who you are. And that's what I did not know. Cecilia speaks a little bit of Spanish, so she's really good on that. But Dr. Santiago speaks Spanish, so that just, and all his staff in that office. So I just wanted to share that story, that I've been working with VIP, and that has been one of those great partnerships that we as SNR Services has established.
Thank you, Rosie.
Awesome. Yeah, and you know, I know there's not VIPs everywhere all over, Florida, and we have people in different states here on the call as well. But these events, these strategies are universal. You can use them anywhere. You have to experiment. I don't think that, there's a one size fits all. Maybe community events inside the facilities work great in some areas, but not in others. I get it. You kind of have to experiment, and you have to go out there and try different things until you find something that works for you. For me, it was always working with the provider groups. That's what worked for me. That was my background. So making friends with people that are looking for the same people you are makes sense, right? So you're going to trust your clients with VIP. They're going to take good care of those people for you. And in return, they may not be able to give you, lead for lead or client for client, because that would be impossible. But if you're really putting patience with them, they're going to take you out on some events and give you some opportunities to get in front of seniors. And that's a true partnership. That's a true partnership. And you don't have to work with everyone on the team, but, pick the one that you jive with, that works well with you, that you guys have a little fun together and make friends. That's what it's all about in this business. And I think you'll do really well with that. So that's my 2 cents.
That's great.
All right. Anything else to add that you guys want us to know about VIP? Any news or anything fun upcoming? All right. Well, if not, that's A-okay with me. Listen, everybody, they put their contact information in the chat. And if you are unsure who to reach out to, you can reach out to us and we will reconnect you with whoever's in your market. Again, support at askhpm.com or 844-696-3975, and we'll get you connected with a folk there at VIP Care or Salute VIP. So thank you, Jerry, very much for being on the call this morning, and thanks to your entire team. I really appreciate everybody being here. And please continue to reach out to us. And if you can't find an agent, we'll find one for you. So just let us know.
Yes. Thank you guys. So I put my phone number and my email. So just give me a call if you need help. Not only with my territory, we are a team and we know each other. So let me know.
Awesome. All right, everyone, that is it for today. We will be back next week, same time, same station. And as a reminder, if you're unable to join our Monday calls, these are being recorded and we are hosting them on YouTube. So make sure that you go out to YouTube and subscribe to Health Plan Markets. And when we drop a new video, you will be the first to know about it. So you can learn about incredible people like VIP, Salute VIP on the call today. So thanks again, guys. I hope you have a fantastic and productive week. Take care.